Good morning, everyone. My name is Jin Long Guo. It's my honor to be here to share my research and experience. And the topic today I would like to share with you is multidimensional prediction model for hearing disability in acute stroke patients. Stroke patients suffer from many functional disabilities, such as the walking disability and cognition impairment. And hearing loss, in fact, is the potential functional disability in stroke patients. Why? Because hearing is the basis for communication in acute stroke rehabilitation. And hearing loss avoids stroke patients to join rehabilitation programs. According to previous research, the risk of decline in physical function is about 83% higher among stroke survivors with hearing impairment than those without. So, early detection of hearing loss in acute stroke patients is very important. This issue, however, has not been investigated as much as other neurological impairments. Especially, clinical stroke assessment scales, such as the NIHH scores or multiple ranking scores, merely emphasize impairments related to motor skills or cognition function. Just a little attention was put into this issue of hearing assessment in acute stroke patients. So, the aim of the study was to determine the association between hearing loss and stroke risk factors, and we believe this study will serve as the basis for early detection of hearing loss in acute stroke patients. Methods. The study was conducted at the Department of Neurology in Taipei Veteran General Hospital. And this is one of the biggest medical centers in Taiwan. And this is my research team, and the team comprised an ENT doctor, that is me, and 3 qualified audiologists, these 3, and a US registered nurse, who is my wife. And all of the hearing tests were performed by the same audiologist, Mr. Yang, this guy. And background noise monitored in the ward. During the hearing test, the room was kept silent as much as possible. And to monitor the background noise, a digital sound level meter was put at the same height as the patient's test ear at a distance of 3 to 5 centimeters away from that ear. As you can see, this is the sound level meter. In every hearing test, the background noise level must be under 40 dBA, which is about 10 decibel, to minimize the background noise. And this is the audiometric equipment. A portable audiometer with a wobble tone stimulus was used for hearing tests at frequencies between 500 Hz to 8,000 Hz. And this is the portable audiometer. And the headphone covering the ear was used to further reduce the background noise. And this is the noise cancelling headphone to further reduce the background noise. SRT testing was performed as well on both ears to validate the major hearing thresholds. And the Chinese spondy words were used for SRT. And you can see this is the Chinese 2-syllable words. And the male voice was recorded for SRT test. The voice files were sent on an iPhone. And the voice files were played using the TuneCell app. And the default volume setting of app was 65 dBA with minimum and maximum volumes of 40 and 80 dBA respectively. All of the major hearing thresholds were validated by ensuring that the SRT level of each patient was within 6 decibel of the average major hearing thresholds. For patients with aphasia and dysarthria, they were provided pictures of the corresponding spondy words to complete the SRT test. Before hearing test at bedside, the ENT doctor used a portable binocular microscope and otoscope to examine the ears, and the cerumen was removed by an alligator or 4 steps to facilitate hearing test. Variable definition. Hearing loss was defined as an average hearing threshold of more than 25 decibel at 500, 1000, 2000, and 4000 Hz in a better ear. And hearing disability was defined as an average threshold of more than 40 decibel in accordance with the definition provided by the WHO. An informed on self-perceived hearing impairment was obtained using a previously validated question. So we asked the patient, do you feel that you have hearing loss at the bedside? Results. During the period of 8 months, we prospectively included 115 patients. Among these patients, only 37% reported self-perceived hearing loss, but 55% had a major hearing loss, and 23% even showed hearing disability. Among the 63 patients with major hearing loss, more than half, which is the 54%, did not report self-perceived hearing loss. These findings indicate the majority of the stroke patients may have hearing loss, but most of them may not be aware of this problem. Among the 115 patients, 70% were male, and 94% suffered ischemic stroke, and 67% presented a deficit in anterior circulation, and 82% experienced only minor stroke. The mean age at the time of stroke was 17.3 years, and the range was 35 years to 93 years. The average duration between admission and hearing test was 4.57 days. Compared with patients that did not present hearing disability, those with hearing disability were more likely to be older and more likely to have a history of coronary artery disease and have a low BMI and reported notable self-perceived hearing loss and have high major hearing thresholds in better and worse ears. This table presents a multivariate analysis of clinical factors associated with hearing disability in acute stroke patients. According to this table, older age was associated with a 70% increase in the risk of hearing disability, and a higher BMI was linked to a 30% decrease in the risk of hearing disability. And also, we observed a remarkable rate of hearing disability in patients with self-perceived hearing loss and in those with a history of coronary artery disease. You can see the odds ratio was very high, which was 5 and 8 respectively. And to explore the association with age, we calculated sensitivity and specificity for various age thresholds. And you can see this figure shows the resulting RC curve and the AUC, an area on the curve of which was 0.854. And the cutoff was 17.5 years with a sensitivity of 100%. This table presents the Unang index for the prediction of a hearing disability according to each age point. Unang index equals to sensitivity plus specificity and minus 1. And power of a prediction increases if the index is close to 1. So according to this table, we determine an age threshold of 17.5 years. Unang index is 0.6 as the most accurate in discriminating between stroke patients with hearing disability and those without. There is a 100% sensitivity with an acceptable 40% false positive rate. We used the Spearman test to analyze the correlation between age and hearing threshold in the beta ear, and this figure shows the age and the corresponding hearing thresholds of the 115 stroke patients. As you can see, we observe a positive correlation between age and hearing thresholds. And among the 26 patients with hearing disability, which is more than 40 decibel, age more than 70.5 years completely screens out these 26 patients. This indicates age of 70.5 years may be a good method to discriminate stroke patients with and without hearing disability with a sensitivity of 100%. And among the 53 patients that were assumed to be without hearing disability, according to the predicted age point 70.5 years, all of them were proved to be without hearing disability. This indicates age of 70.5 years may be a good tool to discriminate acute stroke patients with and without hearing disability with a negative predicted value of 100%. Discussion. Sudden sensory hearing loss and stroke. Previous research indicates that sudden sensory hearing loss is associated with a significant increase in the risk of a stroke. In the study, however, among the 115 stroke patients, only 2 patients, that is about 1.7%, reported a history of sudden sensory hearing loss. So our research failed to confirm a connection between sudden sensory hearing loss and subsequent stroke. But conversely and interestingly, our previous research showed that stroke patients had a higher risk of a subsequent sudden sensory hearing loss compared with those without. This is our previous published paper. And in addition, acute stroke patients with 1 self-perceived hearing loss and 2 those with a history of a coronary artery disease should be treated with great care because they face the risk of the hearing disability that is more than 5-fold and 8-fold higher respectively. And older age and lower BMI was associated with a 70% and 30% increase in the risk of a hearing disability. And our Z-curve confirmed that age more than 70.5 years was beneficial for the discrimination of hearing disability in acute stroke patients. And the sensitivity was 100%. You can see the right upper quadrant, the 26 patients, when the age threshold of 70.5 years is applied to discriminate between acute stroke patients with hearing disability and those without. And the age threshold of 70.5 years also has a negative predicted value of 100%. You can see the left lower quadrant. This is the 53% per patients. Conclusion. Our study indicates the need to raise awareness of potential hearing loss among acute stroke patients. And this study identified a multifactorial link between acute stroke and hearing disability. And these indicators could serve as a preliminary screening system to identify stroke patients with potential hearing loss. And these indicators include self-perceived hearing loss, history of coronary artery disease, and older age, especially more than 70.5 years, and lower BMI. Finally, I would like to thank my team, as well as the support from my mentors, including Professor Lin, and Professor Lin, and Professor Xiao. Thank you, and welcome to visit Taiwan.